Hi everyone, I am at Farm Villa today. Bright sunshine, birds singing here in the garden behind Bay Tree House, and yeah, it feels like spring's on the way. It's great, isn't it? Quick vlog this week and a couple of things to cover. A welcome to some new colleagues in my team, so I'll mention that in a minute. Something on vaccinations and the government's position, and then something on hybrid working. So first things first, you might have met, and if you haven't yet you will very soon, our two new execs in my team. So as you know, my team is me and 6, we're a small group, and we have a new chief nurse, and Andy Cruikshank joined us on the 1st of March. Andy joins us from East London Foundation Trust, and if you've been following the health news, you'll know that East London Foundation Trust have just been rated outstanding overall for the 3rd time in a row. So what a joy to have someone who brings that experience with them to us. So you'll see Andy out and about. He's also our Director of Infection Prevention and Control, the DIPSI, and it's Andy who advises me as Chief Exec on what we do next. And I spoke to him this morning, and he confirmed that it's steady as we go. Our rules remain as they are: 2 metres, face coverings, all the guidance that you and I know so well and that's kept us safe all this time. New national guidance is about to be issued, so Andy will be advising me on that, and as soon as we have the information we'll share it with all of you. So welcome to Andy. The second new member of my team then is Chief Operating Officer Donna Hayward-Sussex. Donna joins us from SLAM, South London and Maudsley, so another great London trust, and how fabulous to have new colleagues joining us with new experience and joining KMPT and bringing that with them. So a very warm welcome to Donna. Donna joined us this week on the 7th of March and is already out and about, and you'll have had contact with her, I'm sure. And if you haven't yet, you will. So you will see, as always, you see my team and I out and about. If you see us, come and say hello, and if we haven't been to where you are and you think you'd like to see us, tell us and we'll be there. So see you soon if we haven't recently. So that's a welcome to new members of my team. Something then about vaccination. The government has taken soundings from the Royal Colleges and from trade unions and other sources, and has indicated that he's going to reverse effectively the original directive that all NHS staff had to be fully vaccinated against COVID-19. As you know, that's not something that was in the gift of any of the NHS trusts, and it has been difficult, and I have a lot of sympathy for staff who've contacted me saying how all of that affected them. I am really sorry. It was what it was. We are where we are now, and the new guidance will be issued, so you will hear middle of this month, I think the government will be making an announcement that it's no longer a requirement. So that's that. And then the third thing is about hybrid working. We've been talking a lot about it at the board. You will have been talking about it in your teams. If you joined the leadership event or the big conversation recently, you'll have also been involved in conversations about what does it mean for us, how do we operate, what does it mean for our patients, how do we take all the learning from these new ways of working and hold on to the best of them, and not going back to driving endlessly around the county, wasting fuel and time, adding to the poison on the planet, and not achieving a really effective way of working. So this is the month where you will hear, and there's a film about to be launched, what my team and the board are doing to make a difference, and I hope you'll be really pleased. It feels absolutely the right thing to do to me and to my team and to the board, and it signals really what I've been saying to you over recent months, which is my team and I and the board wouldn't dream of asking any of our colleagues in the organisation to do something that we wouldn't be prepared to do ourselves. So watch out for the film. It will be about hybrid working, and it will tell the story of why my team and I are making the changes that we're making, and what it will mean for all of you, and where we go from here. So I think some simple principles, some KMPT principles about what hybrid working means for those of us who can work in a hybrid way. Of course, there are some who can't. But what the benefits will be, and how actually we can drive up the quality of what we do at the same time as reducing the cost. And when you get those two things going in the right way, you get excellence in the middle. So that's what we're aiming for. So here we are, first week of March gone, heading towards spring. Lighter days coming soon. I hope you're well. Look after yourselves, won't you? And I will see you out and about very soon. Take care.